Ocular surface disease, otherwise known as dry eye disease, is a clinical problem often overlooked in patients who undergo antimetabolite augmented filtration surgery. In glaucoma patients whose intraocular pressures are suboptimally controlled with topical antiglaucoma medications, trabeculectomy is still widely regarded as the treatment of choice. With the advent of antimetabolite use in this surgery, the success rate of trabeculectomy has significantly improved, although complications such as ocular surface disease may compromise visual function post-operatively. Our aim of this paper was to describe the demographics, risk factors, clinical signs, severity and outcome of ocular surface disease in 12 patients who had undergone trabeculectomy augmented with an antimetabolite. 12 glaucoma patients were referred to our dry eye clinic after developing symptoms and signs of ocular surface disease after previous trabeculectomy. Of the 15 eyes that underwent trabeculectomy surgery, 14 had surgery augmented with Mitomycin C. 6 eyes had a diagnosis of primary open-angle glaucoma, 7 eyes had a primary angle closure glaucoma, and 2 eyes had glaucoma due to secondary causes such as aphakia and Stevens-Johnson syndrome. An eye is considered to have ocular surface disease if there are any symptoms of eye discomfort such as gritty sensation, burning, transient blurring of vision, and accompanied by reduced tear breakup time or a lower Schirmer score. The median onset of dry eye symptoms after surgery was 13.5 months. Mean tear breakup time was 5.32 seconds, and mean Schirmer score was 6.14 mm after 5 minutes. On examination, all eyes had punctate epithelial erosions when stained with fluorescein, as shown in the middle picture. Conjunctival injection was also seen in more than half of the patients examined. Topical eye drops used to treat glaucoma in these patients varied. Timolol maleate was the most common eye drop, with 11 patients using this medication currently or in the past. This was followed by prostaglandin analogs with 7 patients on Travatan and 3 on Xalatan eye drops. Alpha-adrenergic blockers were the third most common, with 6 patients using Alphagan previously. Combination eye drops and carbonic anhydrase inhibitors were the most infrequently used. At time of presentation to the dry eye clinic, all patients were treated with lubricants, and depending on disease progression and severity of the dry eye disease, treatment was stepped up accordingly on follow-up. In addition to lubricants, some patients required the use of punctal occluders, punctal cauterization, topical steroids, or topical cyclosporin eye drops. Improvement in best corrected visual acuity after treatment was observed in 7 eyes, with a median gain of 2-line improvement in visual acuity. No improvement in best corrected visual acuity was noted in 3 eyes, and worsening was recorded in 2 eyes. Possible etiologies for this multifactorial disease include pre-existing ocular surface disorders prior to surgery, chronic use of glaucoma medications, and the development of iatrogenic limbal stem cell deficiency. Coupled with direct microtraumatic insult to the limbus during trabeculectomy, chronic use of glaucoma medications with application of Mitomycin C during surgery may lead to the breakdown of the corneal epithelium and development of ocular surface disease in susceptible eyes. Ocular surface disease is often overlooked in patients who undergo antimetabolite filtration surgery. Better understanding of the factors affecting the development of ocular surface disease in patients after antimetabolite augmented trabeculectomy can lead to more targeted treatment and appropriate counseling of patients.